Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
And good morning, and welcome to a Cardinal Minute. I'm Dr. Kim Allen Williams, Chair of Medicine here at the University of Louisville, and it was our distinct pleasure this morning to hear a very inspiring and edifying grand rounds given by Dr. Matthew Rank. He's a professor of medicine at Mayo Clinic in Arizona. He's the chair of the Division of Allergy and Asthma and Clinical Immunology and Allergy-Immunology Special Counsel. And he's the director of the Allergy-Immunology Fellowship Training Program at Mayo Clinic, Arizona. And he spoke specifically about respiratory biologics as a case study for how to use high-cost treatments. Dr. Rank, can you summarize your talk in 1 minute?
Sure. Thank you, Dr. Williams. I focused on the perspective of the healthcare professional using respiratory biologics as a case study and how we as healthcare professionals can deal with the challenges of using high-cost medicines. I discussed a few specific strategies that I think may be effective, and those strategies include being really careful with our diagnoses, using clinical algorithms, clinical guidelines, considering cost-effectiveness analyses in our decisions with patients, using shared decision-making, this concept of bringing in patients' values and preferences, considering cost in this rubric of shared decision-making when trying to come to high-quality decisions with patients, considering how we can use the system to our patients' advantage, thinking about the formularies, thinking about whether we can use this medicine at a lower dose, a lower frequency, thinking about how we can help our patients get the benefit from some of these really exciting and new but expensive medicines. And finally, thinking about healthcare professionals as advocates, serving on formulary committees, being aware, speaking up on behalf of our patients. All of that in sort of this concept of the patient's here in the middle. We are trying to help the patient. All these other groups as well are trying to help the patient achieve these medicines, or acquire these medicines, use these medicines in a way that might help them. And I think the way the system currently is puts us a little bit at risk of inequity, of underusing and overusing these medicines. And I think we can do better, and we will do better.
Well, I really appreciate all the information that you've given us, but also you're inspiring us all to become advocates. Everyone, particularly in academic medicine, where we're at the cutting edge and the forefront, we really need to let our regulators and our legislators know exactly how we can best help our patients with our healthcare system. So I really appreciate that message. Together we are stronger, and our voices should be heard. So thank you very much. It was really wonderful to hear from you this morning. And this has been a Cardinal Minute.